What happens if a polyp is found during your colonoscopy? Imagine sitting in the doctor's office, hearing that during your colonoscopy, a small growth called a polyp was found. What does that mean for your health? Well, during a colonoscopy, doctors carefully examine your colon using a flexible tube called a colonoscope. If they spot a polyp, they usually remove it right then and there through a process called polypectomy. This is a key step in preventing colorectal cancer. The removal depends on the size and type of the polyp. Small polyps, usually less than a ½ inch, are often taken out with a wire loop that snips the polyp without using heat. This is called cold snare polypectomy. For medium-sized polyps, the doctor might use a wire loop with electrical current to cut and cauterize the tissue at the same time, known as hot snare polypectomy. Larger or flatter polyps might need a different approach, like injecting fluid underneath to lift them from the colon wall before removal, a technique called endoscopic mucosal resection. Once the polyp is removed, it is sent to a laboratory for biopsy. This helps determine if it is benign, precancerous, or cancerous. If the biopsy shows the polyp is benign, no further treatment is usually needed, just routine follow-up screenings. But if the polyp is precancerous, such as an adenoma or sessile serrated polyp, your doctor will likely recommend more frequent colonoscopies. This is because these types of polyps can develop into cancer over time if they are not removed. Sometimes, if a polyp is very large or cannot be fully removed during the initial procedure, a follow-up colonoscopy might be scheduled to remove any remaining tissue. In rare cases, if the polyp shows signs of invasive cancer or cannot be completely removed endoscopically, surgery to remove part of the colon may be necessary. Removing polyps during colonoscopy is one of the most effective ways to lower the risk of colorectal cancer. Research shows that removing polyps can reduce the chance of developing this cancer by up to 90%. So, finding a polyp is not a cause for panic but an opportunity for early intervention. In summary, if a polyp is found during your colonoscopy, it is usually removed and sent for testing. Based on the results, your doctor will recommend the appropriate follow-up, which might include more frequent screenings. This process plays a vital role in maintaining colon health and preventing colorectal cancer. Always remember to discuss your specific situation with your healthcare provider, as individual needs can vary.